Welcome back. We are answering your questions about the coronavirus with Cone Health Medical Group family medicine physician Dr. Zoe Stallings. Remember, you can text your questions to 336-379-5775. We've been getting a lot of questions so far, Dr. Stallings. The first one, I am 68 years old. I have health issues. When could I realistically expect to get a COVID vaccination? How would I know when it's my turn, and where would I get it?
That's a very good question. At this point, most of the vaccines that are given to healthcare workers currently, and the plan is to roll out in phases. And so we are targeting those highest risk. It's not going to be given out in the community probably for several more months. The best way to find out is to contact your primary care provider, because as the vaccines become available, you're really going to need to talk to your primary care provider and to be educated about risks and benefits of any vaccine, and also to make sure that the right people are getting the vaccine and understand what to look out for. It's best to talk to your primary care. If you don't have a primary care provider, establish with one, or you can check on the CDC's website. They have a huge set of information that they update constantly about the COVID vaccine.
Do you know if there will ever be a point where we'll be able to just sign up or schedule an appointment, without the primary care provider?
I think while the supplies are limited, that's not going to be something that patients will all be able to do. And I also think it's important, that education piece, because we wouldn't want patients to think that they should just go get a vaccine. What about any allergies? We want to discuss what to expect. There are risks and benefits of everything. The vaccine is safe. So far, the research is showing good information about how it's doing in terms of protecting people who've gotten the vaccine. But there's still other vaccines that are being developed in the pipeline. There are two currently available, and healthcare workers who are on the front line at the highest risk of exposure are the ones currently getting it. So in the future, I just don't know a target date as yet. But right now, we're really starting with healthcare workers and then the highest risk first. And then the plan will be, once the vaccine is mass produced, that would be the goal, is to vaccinate as many people as possible.
Someone's asking, if you knew you were exposed to someone with the virus but show no symptoms, should you get tested anyway?
Absolutely. Being exposed is already putting you at higher risk. And so we would recommend getting a test. You can get a test through many ways. There are many urgent care sites. There are also the drive-up testing sites. I know that you can easily make an appointment by going onto the Cone Health website. I walked a patient through it the other day, and you could see the appointment slots available. Around the holiday season, there are some hour restrictions, so go on there and check what those hours are. However, it was pretty straightforward for that patient who's not that computer savvy. It was just a very easy thing to go in, put your information in, and click the time slot that you choose. And then you can go over to the Green Valley location. We have seen patients also go to the pop-up testing areas, such as over at the Coliseum. Patients have gone to churches and had testing done in the parking lot. Lots of options. You can also go on the Guilford County webpage and find out more testing sites as well.
This question probably will pop up with several people, but they asked, if one of my family members tested positive, should I leave their house immediately, even though I've been staying there for several days during the holidays?
That's a popular question. And what I would recommend, if a family member is positive and you're staying in their home, you may have been exposed even before their test result. So you're still considered high risk. We don't want you to leave that home, because now you're going to expose others. What we'd like you to do is to get a test and to quarantine. You can quarantine in that home. If your test is also positive, you both are positive, stay there. We just wouldn't want you to be exposed and then go to another household and expose those people. It would be best to stay where you are and just get a test at the drive-up site and then go right back to that home.
Someone texted us saying that they tested positive for the virus 12 days ago and wants to know, should I go and get another test to see if I test negative again before I go back into the public or back to my office?
We don't recommend retesting. The reason is that, the test, we really are trying to make sure we get everyone tested that needs tested. However, if your test is positive, it can remain positive. So what we recommend is, if you have a positive test, look at your symptoms, but if you're asymptomatic, we want you to quarantine for the 10 days. Or if you are positive, stay home for the 10 days don't retest, but watch your symptoms. So let's say you're positive, but you're still coughing and still wheezing, and now we're at day 16. Now's a good time to really talk to your primary care because maybe you have bronchitis. So it doesn't mean that we want you to just live in a bubble, but retesting won't give you the result you want. Plus, when you go back to work, you have to wear your mask anyway. Our goal is to make sure that you're not going out into the public in the most infectious state. And that's early on in the virus, when you're first beginning to multiply that virus rapidly in your system. We want you to stay home and isolate, hydrate, make sure that you're following up with your primary care and talking to someone about your symptoms if they're not improving.
Okay, Dr. Stallings, we've got a lot more questions coming in, so we're going to take a quick break and we'll get to more of them right after this. You can keep texting your questions to 336-379-5775. We'll be back.